Hi, I'm Dr. Uma Maheshwari. I've done my MBBS and DGO. I'd been into my own practice for about 10 to 11 years and later felt a need for the infertility fellowship. I joined Rajiv Gandhi University of Health Sciences affiliated fellowship at Garbhagudi. I finished my fellowship recently and I had a good hands-on experience at Garbhagudi, and also we had a good theory classes and also we had good planning throughout the year. We had a transvaginal scan experience here on the simulators, which was really very good. Initially we had a lot of struggle doing the transvaginal scans during our practice, but with the help of Dr. Supriya ma'am, with her suggestions, we had done an excellent scan training here, and which is definitely helpful for all the gynecologists and also the infertility specialists. And slowly with this experience we started doing scans in the OPDs as well. We had good hands-on over the patients doing the transvaginal scans. During our fellowship we had lots of student presentations wherein we had a lot of time to research about the topic, then present it over to all the students in front of the consultants, which was a good experience as well. We had frequent assessments at GGIRHR once in 4 months, wherein we had the theory as well as the practical examinations, which was a lot of help during the university examinations as well. Now at the end of the course, I'm really very confident to tackle any kind of infertility patients after doing my course at DGIRHR, and also would recommend the gynecologist to take up the proper infertility fellowship instead of having a certification courses for a short duration, as they'll have good exposure in all the in the field of genetics and also any complicated cases all in all. So it is a good option to have a fellowship than a certification course. So would recommend them to go for a proper fellowship courses. As I thank GGIRHR for giving me such an opportunity. It was a great help from all the team of GGIRHR. Thank you all.